Hello everyone, my name is Jack Boulet. I'm the Vice President for Research and Data Resources at the Foundation for Advancement of International Medical Education and Research. My TED Talk is titled, How Does Assessment Help Maintain Standards in Health Sciences Education? There are many types of assessments that are employed in health sciences education. They utilize selected response formats, such as multiple choice questions, true-false items, and various types of constructed response formats, including essays, oral examinations, procedural skill tests, and many more. They are typically categorized as summative, or assessments of learning, or formative, assessments for learning. Regardless of their purpose, assessments tend to drive learning. Students study material that is going to be on the examination. If the examination or examinations cover the relevant domains or competencies, the students are more likely to learn what is needed to be better practitioners, including the knowledge and skills required to deal with patients. There is always also evidence to support test-enhanced learning. That is, students learn by taking tests. If these tests are spaced at regular intervals and meaningful feedback is provided, the educational effect is even greater. With this in mind, assessment can help maintain standards in health sciences education by enhancing the quality of the program and therefore the competence of the graduates. But how does assessment help maintain standards in health sciences education? The answer to this question is not so simple. It depends on how well the assessments are constructed, whether they are aligned with the curriculum, and the nature and the quality of feedback that can be provided from the scores. All of these factors play an important role in determining whether, and if so, by how much, assessment can improve standards. To understand this more fully, one needs a basic understanding of reliability and validity, both of which are properties of the assessment scores. Reliability of assessment scores is extremely important. If they are not reasonably precise, then our estimates of student ability, who is excellent, who is poor, are error-prone. If we use these scores from an assessment to identify weak or strong performers, we could be making mistakes that could actually have negative impact on the educational program. Likewise, if we use the scores to identify performance gaps, or what we call curriculum holes, or provide feedback to students, we may be providing unreliable information. This is not fair to the students, who may change their study habits, or the instructors and course coordinators, who may change the curriculum. All in all, assessments need to provide reliable scores to be of any use. While the score precision we will be willing to accept will depend on the stakes of the assessment, more formative assessments may not need to produce as reliable scores, we still want to be reasonably certain that we are measuring the true abilities of the students. As I will mention later in the talk, we can certainly build better assessments, ones that are not highly influenced by measurement error. When we do this, the assessments will be better vehicles to guide any quality improvement efforts, be it at the student or the program level. Another important concept is validity. Are we really measuring what we think we are measuring? If our assessments lack validity, it is not possible to make appropriate inferences regarding student abilities or the adequacy of the curriculum. Often, assessments are not properly aligned with the curriculum. They can also focus on material that is not so relevant to practice. In health professions education, we tend, at least until recently, to assess what is easy to assess, at least first, and not necessarily what is important to assess. There are many assessments of knowledge, or the application of knowledge, and fewer assessments of what we will call the softer skills, such as communication, leadership, and professionalism. These skills and professional attributes play a fundamental role in patient care and need to be assessed. The key to any assessment program is to make sure that the individual assessments are key to the competencies that you want the student to become proficient in. In health professions education, you will now see a growth in performance-based assessments, including various forms of simulation, including both standardized patients and electromechanical mannequins. This growth is based on the fact that skills like communication are important and can't be measured on your typical selected response examination. So to the extent that we incorporate more assessments of what students can do as opposed to what they know, the end product, a more proficient caregiver, is more likely. This is not to say that assessments of knowledge or application of knowledge are not important. To make a diagnosis or to develop sound patient management strategies, knowledge is at the core. But ultimately, we need to know what students and trainees can and cannot do. As a result, new assessment strategies, ones that target students, what students can and cannot do, are very important. They will enhance the validity of the assessment program. The question then becomes, if we can develop assessments with adequate psychometric properties, how can they be used to maintain standards in health professions education? There are two main areas where this can occur. One, as part of the licensure and certification process, and two, as part of the health sciences curriculum. I will now discuss these in a bit more detail. Most healthcare professionals have some sort of licensure or certification requirements. Assessment is a fundamental part of this process. Usually, there's an exam or set of exams that must be taken and passed to obtain a license to practice. If these exams measure the necessary knowledge, skills, and attitudes to practice in the profession, then passing them sends a message to the public that the individual is safe and has met agreed upon standards. These standards help ensure that the quality of health professions education programs and that the content of the curriculum is often aligned with the certification and licensure examinations. In the United States, medical schools have adapted their curricula to keep in line with the licensing examinations. When the clinical skills examination, part of the United States medical licensing examination, was started in 2004, medical schools began emphasizing communication skills in their curriculum. They also started building clinical skills facilities, simulation labs, etc., where they could train the students to take histories, perform physical examinations and various clinical procedures, and then learn how to interact with patients, or in this case, standardized patients. Well, this was a costly endeavor and ensured that the program had a necessary educational environment to properly educate the students. To the extent that licensure examinations are valid, that is, they prove valid decisions regarding readiness to enter the profession, and the medical students do well, one could argue that the quality of certification of health professionals education is enhanced through the assessment process. The certification licensure assessments effectively force the schools to modify their curricula and to provide additional resources for learning. Assessments can also help maintain health professions education standards at the school or within a program. However, just as is true from the high-stakes licensure examinations, the local assessment must be of high quality. In the curriculum at a health professions education institution is well thought out and the assessments are well aligned, that is, they measure the relevant knowledge and skills, the quality of the program will be enhanced. Here the students will recognize that they're being assessed on the important aspects of the educational program and will be motivated to prepare for any examinations, whether they are low stakes or high stakes. Assessment does drive learning, but we have to be careful that it drives it in the right direction. Perhaps most important, the local assessments, the performance and results can form the basis for program evaluation. The program evaluation in turn can help improve the standards. How this works is fairly straightforward. It does, however, depend on having quality assessments in place, which demands a fairly rigorous faculty development in this area. Let's suppose that a program, say a medical school curriculum, has a strong assessment program. If the students do well in one area, say biochemistry, and not so well in another, say anatomy, one could ask why. It could be a function of the assessments. One is harder than the other. They do not measure the relevant areas. But it also may be that teaching in one discipline is better than another. It could also be that students do not perceive one kind of area to be as important as another. Regardless of the reason, looking at the assessment scores can provide some clues as to where problems exist in the curriculum. They may not tell you exactly where the problems lie, but they do give you an idea of where to look. We need to be more careful, however, on how we use the assessment scores. Making judgments of the quality of individual faculty may not be justified, especially if the assessments were not screened for their psychometric properties prior to their administration. Likewise, if we use assessments to look at growth, for example, we change the curriculum and want to see if the students are doing better, we need to make sure that the performance differences over time are not simply a function of different assessments or different students taking the exams at different time points. I also think that assessment can help maintain standards in health professions education programs in other ways, more indirect ways. The one thing that we often fail to do is provide faculty with adequate training in assessment practices. In these situations, the assessments can be poor, not measure the right constructs, and serve to demotivate the students. So providing faculty with the tools needed to construct proper assessments is imperative. This could involve workshops on item writing, for example, multiple choice questions, essay grading, developing cases for objective structured clinical examinations, using simulation for assessment, debriefing and feedback, and many more other things. All of these educational activities will help faculty develop and administer high-quality assessments, ones that motivate the students to learn. As I mentioned previously, faculty also need to have at least a basic understanding of psychometric principles. They need to know that the validity and reliability of properties of the scores or the inferences we make based on those scores. An assessment can yield valid scores in one setting or with one group of students and not another. Using the same assessment for third-year medical students and third-year residents may not be appropriate. Likewise, the reliability of the scores can depend on a number of factors, including the length of the assessment, the choice and training of the raters, for performance assessments at least, and the homogeneity of the group being assessed. This knowledge will help them evaluate the assessments or assessment programs and, hopefully, improve their quality. They can make their assessments more relevant, develop better items, identify problems with the curriculum, and improve score reporting and feedback. By improving the quality of assessments and therefore the utility of the scores that are obtained, we increase the educational impact. Just to summarize, assessments, if they yield valid and reliable scores, can help maintain standards in health professions education programs. They can tell us where there are weaknesses in the curriculum and where there are strengths, so that we can do something about it. They can also help us identify students who are struggling, so we can help them. They allow us to quantify, at least to some extent, the effect of our educational programs, including any changes we make over time. Always remember, assessment drives learning. Enhanced learning improves the program. But to drive learning in the right direction, we need high-quality assessments. Thank you.